On today's House Call, we're joined by Dr. Andy Darby from the University of Virginia's Heart and Vascular Center. Today we're talking about atrial fibrillation.
Thank you. Thank you for having me.
Pleasure. Start by explaining kind of the basics behind it.
Yeah, so atrial fibrillation is an abnormal heart rhythm. And by abnormal heart rhythm, I mean electrical problem with the heart. And it's the most common abnormal heart rhythm that we see in adults. And what it's characterized by is a lot of abnormal excess electricity in the upper chambers of the heart that makes the upper chambers beat very rapidly and chaotically, but it's exceptionally common.
But something you don't want, so if left untreated, what happens at that point?
Yeah, so the primary risk associated with atrial fibrillation is the risk of stroke. Atrial fibrillation is one of the more common causes of stroke, and that's the primary risk. Atrial fibrillation can also sometimes make the heart rate very rapid, and if that goes on for an extended period of time, that can sometimes weaken the heart. Atrial fibrillation can also cause a lot of symptoms which in some people can really be debilitating. It can cause shortness of breath, fatigue, sometimes it can cause very uncomfortable, irregular heartbeats.
Okay, and as far as treatments go, there's something called catheter ablation that you use?
Yes, catheter ablation is one of our procedure options to treat atrial fibrillation. Essentially what that involves, it's a procedure that's done under anesthesia, so patients are asleep for it, not awake for any part of the procedure or remember anything about it. We put in a couple small IV catheters into the veins at the top of both legs, and through those IV catheters we're able to run some longer catheters into the heart to study the heart's electrical system and determine where it's coming from, and then try to eliminate those abnormal electrical signals.
And how effective is that, and what kind of recovery process is someone looking at?
Yeah, it's very effective. We have two primary treatment options for atrial fibrillation, either medication or the ablation procedure. In general, the ablation procedure tends to be more effective than the medication. I'd say about at least 2/3 to 3/4 of patients are either greatly improved or cured by the ablation procedure. The recovery period, patients stay in the hospital overnight after the procedure, and then I would say about a 3 to 4 day recovery period at home of just taking it easy, just to avoid any bleeding at the sites where the catheters have been placed.
All right, Dr. Andy Darby, appreciate your time this evening.
Thank you very much.
Thank you.